The debate on healthcare reform is now focused on predicting the cost accurately. Logic suggests that investing in prevention will save money long term. Besides, it's clearly the right thing to do. Take, for example, colorectal cancer, the second leading cancer killer in the United States. Some 90 million Americans are at risk of developing the disease, most from a slow process that changes silent, asymptomatic colon polyps into deadly cancers. About 150,000 Americans will be diagnosed with colorectal cancer this year, and some 50,000 are expected to die. Of those stricken with the disease, 58% are men and 42% are women. Sadly, many of the cancerous tumors are discovered too late, mainly because preventive screening is not universal. The fact is, screening can prevent many cases of the disease because most colorectal cancers evolve from benign polyps that develop during a 10-year silent window. A single colonoscopy exam using fiber optics to visualize the entire large bowel from the inside through a tube inserted through the rectum can remove polyps when they're still harmless and decrease the lifelong risk of colon cancer death by 31%. And that's just one exam. Repeating the exam every 10 years does much, much more. Early diagnosis of colon cancer carries an excellent 5-year survival rate of 90% with treatment, but late diagnosis after the tumor has already spread lowers the 5-year survival rate to 10%. Relatively few people are properly screened for colon cancer. Fewer than 20% of adults over 50 have had a colonoscopy in the last 5 years. And if we separate out individuals between ages 50 and 64, the prevalence rates of these tests are lower, and they're particularly low among individuals who are non-white, female, have fewer years of education, lack health care coverage, and are recent immigrants. Of the various screenings available, only one is thorough, diagnostic, and therapeutic, and that's colonoscopy. Preparation involves taking medicine 24 hours before the procedure to clear the colon of stool. On the day of the procedure, the patient is usually put under light anesthesia, and the exam is performed by physicians with special training. The exam directly visualizes the inside of the bowel all the way from the rectum up to a point where the small bowel meets the large bowel, a junction called the cecum. During the procedure, if a polyp or small tumor is seen, it can be removed and sent for pathologic examination. Now, the barriers to proper screening for colon cancer involve misperceptions, money, and mindset. The misperceptions include the thought that this disease only strikes older men, while the reality is that if you're a male or female, age 50 or older, you're well within striking distance. Another misperception that screening for colon cancer is terribly painful and uncomfortable. Well, the reality is that the bowel prep is somewhat annoying, but quite manageable at home, and colonoscopy with light sedation is painless. The expense of the tests can be a roadblock, but insurance companies are coming on board, as they should, because colonoscopy to screen for cancer has been proven to be as cost-effective as mammography for breast cancer. As we move toward a more organized approach to healthcare in the United States, we'll need to look at our priorities and, yes, how we spend our money. The key, as above, is to look at the facts and invest long-term. For Health Commentary, I'm Mike Magee.